Chris, thanks so much for agreeing to be interviewed for IMH Chats. I'm sure we can all learn a lot from your career. Let's start with your daily routine. Can you describe it for us? We know that you're a morning person.
Yeah, well, I think I do something pretty obscene. So I get up at 4 o'clock and then clear my emails. And usually I'm out running at 5 o'clock. And if I'm not running in the morning, I swim. So I swim on Monday and Friday. And the other 5 days of the week I run. And I prefer to get up early because, well, it's cooler to run. But I've always been a morning person, so I quite enjoy that.
And then what does the rest of your day look like?
Well, the rest of the day. Well, let's just pretend that we didn't have COVID. So on a normal day, I'd catch the train into work. Then I work in KGV, so that's King George V building. So although I'm part of the university, I guess I'm in this unusual position where I work across the local health district and the university. And so I guess we're immersed in the health district. And so we do research with researchers and clinicians. And I guess on a normal day, a lot of the time is planning those projects. So in the past, I guess there'd be a lot of it which would be doing the research. A lot of the time now it's managing the research, talking to PhD students about how things are going, postdocs. There's also a lot of it which is involved in putting in bids for, I guess, new contracts to fund research. I guess, yeah, once you get to my stage in your career, you're doing less of the actual doing of research and more of the facilitating, guiding, managing of research. And so some days I wish I could get back to the old days where you could actually have 2 or 3 hours just to do things, like undivided attention. I could just go to the library and I could just read whatever I wanted to read. But I can't do that now. I've got all these other things and other competing priorities.
Thank you. The next question is, what influence has your family had on your academic career and your attitude in general?
I don't think my parents and family did influence my academic career because I don't think, none of them actually went to university. So my mum had a job which is now, she was a punch card operator, which is these people who used to punch holes in cards, which is sort of I guess it's old-fashioned computer programming. They used to punch holes in these cards, which would then go through this enormous machine as big as a fridge to do simple things you could do on your iPhone at the moment. And Dad was a mechanical engineer. And so I guess, what I've got from those are different things. I think I've got, because I grew up in a Catholic family, but it was a very practical family. So I think I've learned the values of, being honest, being fair to people, being generous. Those are the sorts of things I learned, not just from my parents, but also from my grandparents. I think that they really had, a sense of fairness, and they instilled that in me. And maybe that's what gave me an interest in becoming a professor in the School of Public Health. So not directly the academic style of things, but more the ethos that you really should try and make a difference to the world. And it's not about you, it's about what you can do for other people.
Excellent. And if you think back to when you were an early career researcher, what did you find the most challenging and how did you navigate those challenges?
Yeah, well, going back to the day, I think I was I was the second physiotherapist who completed a PhD at the University of Sydney. So the one before me was Rung Tawar from Thailand, and then it was me. And so the challenge at that stage was there weren't many mentors in physiotherapy who could provide people who just completed, freshly minted PhD students with advice. And so I think we looked amongst ourselves for advice. And so I was really lucky that I worked with some people doing their PhDs who turned out to be world leaders in physiotherapy research. So at the same time as I did my PhD, Jane Lanimer did a PhD, Rob Herbert did a PhD, Kath Dean did a PhD. So we actually, sounds a bit odd, but I guess we mentored and supported each other, although we're all actually early career researchers. And so if I look at, maybe it would have been good for me in some ways to have a more senior colleague to refer to. But in other ways, maybe that was good for me, that I learned to be independent and create these things amongst this group of people. And I guess it's worked, because when I look at that group of people, I forgot to mention Kathy Sherrington. She was around at the same point in time, and mostly. It's been an amazing group of people who were all linked to this little suburb in Sydney called Lidcombe. And I think we could justifiably say that, we've changed the way physiotherapy is practiced around the world, and particularly physiotherapy research. Amongst that group of people, I think it would be a fair comment to say that sort of thing.
Definitely. Do you have any tips for maintaining a high level of research productivity?
Yeah, well, it's hard work. And the only reason that you'll put the hard work in is because you love it. And so I think it's a combination of finding an area of research that you're really passionate about. And you can be passionate about it because of the topic, but also passionate because you've got a great bunch of people to work with. And so, yeah, it's got to be hard work. And then at the other side of it, you need to take some time out. And so you need to have opportunities just to have some downtime, spend time with family and friends, have hobbies that are different from your day job. I sometimes worry about people who spend all of their time doing their research. And sometimes that's a trap for PhD students. They try so hard that they get themselves sick and unwell, physically unwell, because they don't take any downtime. So, yeah, I think I'd say to people, hard work in an area you're passionate about, but also take a bit of time to do different things, something quite different from academia.
It's that work-life balance that we're all striving to achieve.
Yeah, I mean, people talk about it, but you've got to find something that works for you. I mean, for me, my hobbies that are different are, I like running, so that keeps me involved. I like old cars, so tinkering with old cars is a little bit different from being an academic. And in more recent times, I've taken an interest in antique carriage clocks, so French carriage clocks. So I like pulling them apart and collecting them and doing stuff. But I guess the thing I find interesting is it's completely different from what I do at work. I can go home and immerse myself in something that's completely different. Reading an old French textbook about clocks. I'm not very good at the French, but I understand the diagrams and the pictures, but it's completely different to work. And so it gives me that downtime, that away time. And I think everyone should try and get hobbies or pastimes, family and friends to give them that downtime.
I think that's great advice. I'd also like to know what you've learned from working with journalists or other health disciplines over time.
Yeah, I guess I've learned a lot from journalists. I think in my early career, I made a mistake because I thought talking to journalists was sort of trivializing research. So I remember people would ring up from the newspaper and all sorts of stuff, and I'd tell them to bugger off. But I don't know why I did that, because to me, once I've actually got to learn more about the journalists and meet them, they're actually quite reasonable people, and they're incredibly important for getting the message out there to the broader community. So I guess I've worked reasonably closely with people from, people like Liam Mannix and the Herald. So we have a good relationship. And at the moment, I guess he helps me get my message out, and I'm helping him write a book about back pain, which is, I guess, a story about his own problem with back pain, but also his dad who had back pain. So, yeah, I never really thought at the time, and I made a mistake. So 20 years previously in my career, I ignored media. That was a mistake, and I'd advise other people not to make that same mistake.
So try and tap into it as a resource as opposed to being scared of it, I guess.
Well, yeah, because we're supposed to be doing things to change policy and practice, to get the evidence out there to the broader community. And so that necessarily involves working with the media. You need to be a little bit careful and make sure that you choose the right journalists to work with. So, people like Norman Swan, people like Liam Mannix, they're fantastic to work with. There are other places where the journalists may not be so good, but it's picking and choosing it. But what's the point of doing research and there's a small number of people who would read it? But if I can get my research in the Sydney Morning Herald, I reach hundreds of thousands of people. The best example is that, with the Lancet series, we managed to get a huge number of stories. I think it was about 170 stories from newspapers around the world. And so, that's an example of using media to get our message out to the whole of the world. And so that's what I achieved in more recent times. And I made the mistake in the past of ignoring that possibility. So please don't do that.
Great advice. What do you think have been your biggest contributions in the research? If we look at successes.
Yeah, if I leave the discovery to the side, because other people might want to judge that, I think the most important thing that I've done is to build capacity. So that's the technical world. But I guess what it is, you know, training young researchers to go off and do wonderful things. And if I look at the people who I trained in their PhD, some of those people are now professors and they lead the field around the world. I guess I could point to having changed physiotherapy research in Brazil. Like I trained, I think, the first cohort of Brazilian researchers who then trained the next generation. I think it's down to the third generation. So I've done a lot in terms of building capacity in that way. I've also brought together research teams, leading different institutes and things like that. I think that is something that I'm pretty proud of. In terms of the discovery research, I guess we've done a whole lot of things about trying to unravel some of the mysteries of low back pain. I think we've discovered some of the things that work, some of the things that don't work, some things which are pointless, some things which are good to do. I guess we've started, but there's still a lot to do. So hopefully some of those PhD students that I've trained have got a lot of energy and they can complete the task. I'm not sure I will complete the task because I turned 60 in March. And so I don't think in the next 10 years I'll solve all the research questions relevant to back pain, but I'm sure people who've been trained by me will be able to do that.
We all know that you're a strong supporter of women taking on roles in research and leadership, as you just told your legacy of training all the PhD students. Can you tell us more about your thoughts on gender equity?
Yeah, I guess I grew up in an old-fashioned environment, you know, back in the day. But I think I've learned more about these issues having worked with really good people in the physiotherapy profession. So if you look at the physiotherapy profession, you know, I guess it's hard not to appreciate the value of women in the profession because there's often really strong leaders who are women. So if I look back at the people who are influential in my career, people like Roberta Shepherd and Janet Carr, they are women. And so, you know, over time, I learned that women could provide an important contribution to the science and practice of physiotherapy. I guess I learned a lot about some of the gender equity issues from Jane Latimer, who's been a very good colleague. I've worked with, well, I went through undergraduate physiotherapy with Jane, and I'm now nearly 60 and Jane is 60. So I've been exposed to Jane's way of thinking and also her twin sister, Elizabeth Broderick, who was the Sex Discrimination Commissioner. So I guess I've been lucky because I've received, I guess, what Liz was promoting across Australia and around the world via her twin sister Jane. I guess I've had continual education about these issues and strong discussions with Jane, and I see that, you know, that these issues are important. Some people sometimes say to me, Chris, you know, it's great that you do these things because you've got a daughter, but that's a really bad reason why you would want to be involved in promoting women in research because you've got a daughter. You know, hopefully if I had a son, I'd be doing exactly the same thing. So, you know, that's when people say that, I just look at them and go, well, you don't really get what this is about. And you probably don't get what I'm about. It's not about me doing things to give my daughter an advantage. I do these things because I think they're right. And I guess that comes back to my upbringing with my family. They taught me that things are wrong and things are right, and this is right, so we should pursue it.
Excellent. And do you have any other tips or take-home messages for early career researchers?
Yeah, I would say talk to each other, grab all these opportunities, you know, be careful about saying no to stuff, be kind to each other, be supportive to each other. I think the best example of what I see that works well is our tea room on level 10 of King George V building, because I see these people turning up, talking about their projects, sharing their lunch, working with each other. Like once you have that environment, things are going to work really well. And so, yeah, immerse yourself in a strong, supportive environment. I sometimes come across early career researchers and PhD students who are isolated. They're just themselves in a department. And you can tell it's not working. They've got nobody that can guide them, nobody that can help them out because they're a little bit further advanced. They don't have a shoulder to cry upon when days are really tough. So yeah, I think you've got to find that team who will provide you that support. And it's the educational support, but I guess it's also the psychosocial support, because at the end of the day, researchers are also humans, and so they need that as well. They need to be nurtured and nourished. And it might sound trivial, but just turning up to the tea room and talking to your colleagues, sharing your lunch with them, you know, that really helps. And I think we need to to make sure those things are happening for our students and to look after them quite well.
I agree. I think that informal sort of bouncing ideas off each other is so important, because that's where you might come up with the best collaborations and ideas, just mentioning something casually over lunch, and then it grows from there.
Yeah, and it needs to be in an environment where you're prepared to say anything. You're not worried about saying something and someone belittling you or thinking what you said is wrong. It needs to be this open, accepting environment where you can bounce ideas around, and at the end of it, you might decide that your idea was pretty poor and you can abandon it. But unless you've got the opportunity to freely say these things amongst, colleagues who are willing to help you, it's really difficult to progress. And so I think I come up with lots of really bad ideas and a range of people convince me they're bad. And hopefully amongst the bad ideas, there are some ideas which are good and you can work with. But you really need some close colleagues that can help you distill out the good ones from the ones which are not particularly good.
So having that safe environment where it's okay to make mistakes and
and acknowledging that you can make a mistake and leave it behind and move on. Like some people, I won't mention names, but there are some people at the university, they've obviously made a mistake and they realise it, but they're not going to backtrack. And it's just a disaster. But I'm not worried about losing face by saying, well, that idea I came up with last week, yeah, it's a bad one. Let's just move on. And I think the same thing has to happen at all levels of academia, from PhD students, ECRs, MCRs. We can all come up with really bad ideas, and we need someone who can tap us on the shoulder and say, hey, Chris, that's a bad idea. Why don't we try this?
You're going the wrong way.
Yeah, and I've got colleagues like, Jane Latimer, Kathy Sherrington, who can come and have a conversation with me and tell me I'm wrong, and we can have a difference of opinion. And at the end of it, we're still good buddies. And I think that's probably the basis for why, I guess, the leadership at the institutes work really well. We have different people. Jane doesn't look like me, Kathy doesn't look like me, Bethan's different again. We all bring different things to the table, and we're all willing to tell each other that, look, no, stop that, that's a bad idea, or reinforce it. Maybe I'm being too negative. We also say to each other, that's a brilliant idea, Kathy, or that's a brilliant idea, Jane, let's run with that. And we support each other. And so, yeah, maybe I haven't said that, but I'm really lucky to have that group of 4, including myself, so 3 other people that provide leadership. And so sometimes I feel it's a bit unfair that I'm labelled as the director, because if I didn't have those other 3 people, I'd be a terrible director. It's only because I've got those other 3 people to round me out so that I look like a complete director. If it was just me by myself, it'd be this lopsided person who misses out on some things. I mean, the best example is Jane. I mean, she has more, I guess, personal skills and social skills and that side of things that I don't particularly have. But then I think I'm much better at organising things than Jane is, and probably a better cook than Jane as well. So
you complement each other.
Yeah, exactly. And we shouldn't be afraid that we're not, the mirror image of each other. That what works here is we've got 4 different people who love working with each other, and that's what achieves what we achieve. That's the secret to it.
I guess that's what makes a great team, that everyone has their different skills to share and collaborate.
Yeah, I think sometimes when people are too similar and probably at the same level, there's a lot of headbutting because you're trying to work out who's the best amongst 2 similar sorts of people. But if you've got different skill sets, you don't need to do that. You're not driven to do that, because I'm not trying to be the best in the portfolio that Jane does, because I've delegated that to her. And she's taken it on. And the same with Kathy and Bethan. I wouldn't pretend to tell Bethan about rheumatological issues or inflammatory arthritis, because she's the expert in that area. And so that's the luxury of having a directorship which has 4 different but complementary people.
And I think we're also very fortunate at IMH to have that collaboration between the local health district and the university as well, that we can tap into those resources too.
Yeah, I agree. I mean, there's sort of 2 lots of resources. There's resources which are financial, and I guess resources which are the building. But sometimes we don't emphasise enough the resource that is being able to walk down the road and talk to someone like Chris needs. So an experienced rheumatologist, if I wanted to get some advice about how I might set up a back pain study, Chris has got a wealth of clinical experience. Peter Youssef. We've got a range of people that we can draw upon. So I think that one of the resources that we have at IMH are the experienced clinicians across all of the campuses. So Concord, RPA, Canterbury Hospital, across all those sites, we've got tremendous opportunities that we can take advantage of.
Which I think is an important thing for prospective PhD students to consider as well. This is a place where research becomes translated into clinical practice pretty quickly. It's not just theoretical research and just sits on the shelf for a couple of decades, and it's real life translation that happens.
Yeah, exactly. And I mean, I'm really proud of the fact that, you know, where I'm at the moment is that our research doesn't involve test tubes, doesn't involve rats, doesn't involve poor animals stuck in cages somewhere. You know, our research involves, you know, real people getting real treatments, and we're trying to improve real health systems. And so what we do, you know, people can look at and go, wow, that's really important. And our discoveries, you know, I talk about them being, you know, at or near the point of care. And so the people talk about the gap between discovery and translation. You know, if you're working in basic science, it might be 2 decades before what you've discovered potentially makes a difference to humans. Whereas what we do, we can do an implementation trial and we can change practice, and we can demonstrate that within 1 or 2 years. And so to me, that's what's really, you know, really strong, what's really persuasive. That's the wonderful thing about working in this environment, that we're doing research that will make a difference, and will make a difference now, not in 2 decades' time.
Thank you, Chris, so much for sharing your experience and chatting with us today.
Thank you, Alla.